Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about what we can do if we're struggling in our knee replacement, rehab, and recovery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our videos. So the first thing I want to say is knee replacement, rehab, and recovery is not always a smooth process. And I would say actually more often than not, there's going to be some obstacles. There's going to be some setbacks along the way in your rehab and recovery for most everyone. And so the first thing we want to talk about is that this is normal. These things are very normal. So a couple things to think about. So maybe you're just progressing very slowly. Maybe you've hit a plateau. Especially in those early weeks, early months after surgery, this is common. This can happen. You can feel like you've hit a plateau, you're not getting any better, you're not getting, the pain's not decreasing, you're not getting any stronger, you're not getting any more bend or straightening, range of motion. And this is common. And what we want to do is just, stay the course, continue with our exercises, continue with our range of motion and our stretching. Even if you aren't seeing that benefit, you are still making progress and still building to hopefully breaking through that plateau. And we'll talk about some more tips as we go along, but definitely one of the main ones is trust the process, stay the course, trust in your therapist, trust in your healthcare team, and you'll see progress with time. So another thing to think about is flare-ups of pain. Again, this is very common, very normal. It's to be expected in some respects. We want to manage pain and be on top of pain. But unfortunately, those flare-ups, they're going to happen as you're rehabbing and recovering. So some other things to think about are just challenges with therapy. So feeling like the exercises are too hard, feeling like they're causing you pain. Maybe you don't have a good connection or a good relationship with your physical therapist or your other healthcare providers. And you're just maybe frustrated by a lack of improvement that you're not seeing. Again, these things can happen. And we'll talk about some ways to deal with that. And just understanding the emotional impact as well, that when you have setbacks or you're not seeing the progress that you want, it's normal to be frustrated, to be anxious, to be depressed. To have these emotional challenges is a very normal part of the process. So what can we do? Well, one is we have to have realistic expectations going into the rehab and recovery and the surgery itself. And we have to develop patience. This is very, very easy for me to say, very hard to implement and do. But really, rehab and recovery is a marathon. It's not a sprint. Progress might feel slow, but that doesn't mean that you're not moving forward and making meaningful progress along the way. So being patient, understanding that this rehab and recovery is not going to happen overnight. It's going to take many weeks, many months to really get back to where you feel less pain, more mobility, better activity tolerance. The other thing is maintaining good communication with your healthcare team. So that's your surgeon and all the providers within your surgeon's office. It's your physical therapy and rehab team. It's your primary physician. Just talking about the challenges that are going on. If something's not going as expected, like pain or a lack of mobility, it's essential to have that discussion. There may be something that the doctor can adjust something with your routine, your medication. It may be something with your physical therapy progress, what exercises or what activities or management strategies you're using. Your healthcare providers are there to help you address these challenges head on. And we need to manage pain, so managing pain effectively. This includes pain medicine, but it also includes things like icing, elevating the leg, mindfulness strategies and techniques, massage techniques, looking at, possibly talking with your healthcare providers about alternative therapies, acupuncture, massage therapy, aquatic therapy, getting into the pool. So it's really important to manage pain and stay on top of pain effectively, as that's going to be one of the biggest hurdles that you potentially will have to deal with. And making modifications, like I was saying. So talk to your physical therapist. If maybe there's a particular exercise or activity that's really aggravating your knee and causing these flare-ups, Maybe there's an alternative way to do it, or maybe there's modifications in that exercise to make it less painful but still get the benefits. It might be something that, focusing on a gentler movement or doing ways to just boost confidence and start with a less intense exercise and build up to the one that is giving you trouble. So things like that. And we want to celebrate the small wins. We always focus on the big picture, the end goal, but we celebrate those small wins along the way. Simple as getting through a tough physical therapy session, tolerating walking a little bit further. These are things that are great. These are things that you should celebrate and feel positive about. Remember to incorporate rest and recovery. It's not always go, go, go. There's a lot of hard work. There's a lot of physical therapy and exercise and things in your rehab and recovery, but we also have to let our body rest, let our body recover. So don't hesitate to incorporate that along the way as well. And then this last part, I just want to talk about the emotional impact of all of this. It's normal to feel frustrated. It's normal to feel discouraged at times, but it's important to not let those feelings dominate your rehab and recovery process. So what can we do? Well, seek emotional support. Maybe that's a family member, maybe that's going to a support group, or speaking with an actual psychologist or therapist about the emotional burden and what you're dealing with as you rehab and recover from surgery. This can be just as important or even more important than the actual physical therapy exercises and activities that you're doing. We want to stay positive. We want to have a good visualization of a positive of success and a positive mindset. And again, this is easier said than done, but visualize that end result. Visualize that goal, that light at the end of the tunnel, walking without pain, being able to get back to that activity that you enjoy. It takes time. It's a marathon, not a sprint. But understand, have that target, have that goal, and keep a positive mindset that you're going to get to that goal. And just have a routine, have habits. Develop the habit of doing your exercises, of pain management, icing, and elevating the leg and massaging the leg. Develop that routine and that habit, and you can do it consistently. And that consistency and patience will pay off in the long run. So I hope this helped provide some useful advice and encouragement for those of you who may be struggling with your rehab and recovery after surgery. As always, please be sure to leave your questions and comments below, and I do my best to get back to everyone I see. Thank you very much for watching.